Okay, thanks you guys for coming to our division meeting. We have these twice a year, as you know. Changed the times up a little bit so that we're not doing them at the same time as the what used to be Ted's forums. Now they'll probably be Michelle's forums. I'm pretty sure she's going to continue to do forums. So kind of doing them in September and then maybe again in, or February and maybe again in September. So try to do them a couple times a year. We've come a long way in a year. A year ago I was standing in front of you in this room and we were talking about DIA and all of the stuff that we were going through, and so I feel like it's been quite a journey. I feel really, really good about the journey, and I'm going to talk a little bit about some of the changes we've made, kind of some of the goals that we're going to focus on in 2019, and yeah, kind of build on some of the things that I think we've already done. So I want to start with one of the things that, you know, when you do your annual engagement score, engagement surveys, one of the things we talk about is, I feel like I know how we're connected to the system-wide goals. And as a hospital, not just our division, but as a hospital, we don't always, like, it doesn't feel like we always understand how those dots are connected. So that's one of the things I want to help do today, is connect those dots. So this is a system-wide goal that in 10 years, Unity Point Health will be the preeminent health system in the Midwest for our transformative redesign of healthcare experience for patients and communities. So when you hear that, what are some words that like stand out to you in that statement?
Preeminent.
Preeminent. Preeminent, right. So we don't want to just be like the okayest healthcare system in the Midwest. We want to be the preeminent. We want to be one of the best. What else? Transformative. Transformative. So when I think transformative, I think about, in fact, in a leadership group this morning, when we were going over some of the financials, one of the things that Mike, who's our CFO, was talking about was we have to be transformative to really maintain financial viability in the healthcare market. And so that means we can't just make incremental little changes. We have to really think big. We have to ask big questions and think not just 2019, but we need to be thinking 2020 and 2021. And how can we really make some big changes? Anything else that stands out to you in that statement? One thing I like to point out is 10 years. So we're not saying that we can transform everything in 2019. So we're looking at a big picture, and you know, within 10 years, how can we be the preeminent health system in the Midwest and be transformative? And when I think about our division, some of you have heard me say this before, I want us to be that for behavioral health. I want people in the Midwest, for sure, to say, who's doing this really well? Who's doing inpatient psychiatric services really well? Who's doing adult partial hospitalization services, chemical dependency services, whatever it is? Who's doing that really well? St. Luke's and Cedar Rapids is, I want to go there, and I want to see what they're doing, and I want to try to see if we can do what they're doing. So when I think about how our division ties up to the system-wide vision, that's what I think. And I think that we can do it, and I think some of the things that we've done in this last year shows that we can do it. So most of you, I think, have seen the roadmap before. So this is the roadmap, and we've transformed. So we used to have this sort of house thing where we had an integrated plan. Then we developed a new vision, and a few years ago we started this roadmap, and this year we have what's called Roadmap 2.0. So we've changed some of the wording. It used to be exceptional care delivery, and we've changed it to be care delivery, care financing, care innovation, and care experience. I'm going to talk, most of what I'm going to talk about today is that care experience, because as frontline staff, that's what you guys have, that's what you touch every day, that's what you have the biggest impact on. You have impact on other things as well, and I may highlight a few of those, but that's really where, for you guys, the work you do every day, it's that experience that you have with the patient and their family members, and the changes we can make every single day. Then on this this compass. We have the best outcome for every patient every time, and improving the health of the people and the communities we serve. So that's like the bigger, broader system statement. We all know what our personal mission is here at St. Luke's, to provide the health care we'd like our loved ones to receive. And for me, that, if you follow that, that lays the groundwork for everything you do. And then the focus values are around the outside of that. The other piece that we're going to talk a little bit about is our brand promise. Who knows what our brand promise is? We just celebrated it last week. You matter. So you matter is our brand promise. We, you know, that's our goal with every patient that we work with, to help them see that they matter. And for us to understand that they matter to people that love them and their family and friends. That's just a bigger picture of how we get there. And throughout the year, part of what I hope you see when you do your PAs and some of the goals that are on your PAs helps, it cascades up to the system-wide goals. One of the things that we do every year, so the system sets goals, then St. Luke's Hospital, Cedar Rapids Region sets goals, and we want to make sure that all of the goals we set at a department level cascade up to the hospital-wide goals, so that we are all focusing on the same outcomes all the time. So what are we going to talk a little bit about today, or goals for 2019? One is that care experience. Like I said, that's what I'm going to talk mostly about today. I'm going to show you just a little bit of patient experience survey. So on our inpatient units a few years ago, we started doing Press Ganey. I'll talk a little bit about, you know, where I think we really need to focus. As a hospital, we're focusing on explain in a way that patients and families understand. So there's going to be some talk about teach back. You know, what does that really mean? What does that really look like? How can we really incorporate that into the work we do? I think many of us have heard that terminology, but you know, have we really incorporated it into our work? Do we really know what it looks like? There's some data that I didn't put on in this PowerPoint, but it's something like 50% of the patients that we give information to only retain like 20% of what we tell them. So the information we give them at discharge, most people aren't grasping most of it. Last week my dad was in the hospital here at St. Luke's. We had a palliative care consult, and I could tell, my mom and dad are in their 70s, they're struggling with kind of adjusting to my dad's diagnosis, and she was doing a fabulous job explaining, you know, kind of the next steps and the I-post, but I could tell they weren't really getting it. So I literally said to her, I said, let's take a teach back moment here, and so I tried to re-explain it in a way that I thought my mom and dad understood, and I think they did. But we need to, you know, make sure that we are doing that, using those teach back moments, so that our patients and their family members understand what that next step is for them. So there'll be more to come throughout this year about that. Staff engagement, as always, we will continue to focus on staff engagement. I don't know when our next survey will be, because we're switching companies again, so I don't know what the survey will be. Typically, we take it around May or June, so hopefully that will happen. There's a culture of safety survey, though, that you will all be getting in March, so I'll encourage you all to take that survey. We're doing a lot of work right now on hospital-wide safety. I feel like that's something in our division we focus on continuously, but in the culture we live in, there's, you know, I just was talking to Sue Slattery in HR after that recent shooting this last weekend, whereas they were terminating somebody, and so, you know, it just raises awareness. It doesn't matter where we work, there's some risks involved, and just being in this world, right? I mean, so we have to understand what are some safety risks we can put in place, what is some awareness we can all have, to try to make this the safest workplace we can. And then we're going to continue to focus on trauma-informed care. And some of the stuff that I'm going to talk about today really falls under that. Many of you who have been here for a while remember when we rolled out all of the engagement model, we talked about all of the ACE stuff. We pushed that really hard about 10 years ago, but I feel like maybe we haven't done as good of a job as we could have with new employees and as we've had some turnover. So this last year, as you know, we've really focused hard on that. Talk a little bit about therapeutic milieu too, which is sort of some terminology from the ancient times. Okay, so press gaining. The two things that we're really focusing on, if you've seen those surveys, there's lots of questions, but they can run this report that says, if you impact these two things, it will impact your patient satisfaction overall. And one of them is the nurse's communication with the patient and family regarding their treatment. So if we can improve our communication with patients and families, that's going to improve all of that survey. And the second one is the provider's communication with the patients and families about their diagnosis. So we'll be doing some work with the providers as well, don't you worry. So this is just for the month of January. The thing I want to draw your attention to, so this is 50%. You might go, oh, I don't know if that's good or bad. Here's what I really want to draw your attention to. We have an N of 4. That's for all 3 inpatient units. So for 3 inpatient units for a 30-day period, we had 4 surveys returned. So and just to give you to explain a little more, in 2018, 2 East had a total of, I think, 21 surveys returned. 1 West, I think, had 22 or 23. And 3 East did a really good job, and it was, what was it, Alexis? 60. So you surpassed, you had 3 times more than the others. But so our first goal really is going to be, what are some strategies we can put in place to get more surveys returned? Because we really don't know what our patients think if we don't get those surveys. 2 East has implemented some strategies specific to that. It's a little more, while it's more challenging on 3s because you have the families as part of that, it seems like we're doing a better job to start with, so maybe there's some things we can do there to improve that. But either way, you know, we know that this is one of the things we need to focus on, and so we'll focus on that explanation piece, but really I want to focus on how do we get them back too. Again, this is the doctors. They would look at this and think they're doing awesome because they have 100%. Again, the N size of 4. But you can look at, you know, prior to that, they're clear down here at probably, I don't know, 25%. So it's all over the place, but part of that's because we're just not getting the surveys back. But I'm going to try, especially as we get better, because I'm sure we are going to get better, we're going to get more surveys back, I'm going to bring these results to you guys more frequently. So you see how we're doing and how we can better. I think that you guys doing the work every day, you're the ones who are going to be able to figure out how can we do a better job with this. You're going to come up with the strategies to do that. The other thing I wanted to share with you, Deb pulled together some data. We look at restraining seclusion data every month. So one of the things I asked Deb to help me with is let's go back as far as, you know, as we sort of could easily, and let's see how we're doing with restraining seclusion over time. So this is restraint, and you can see it goes clear back to 2011, and we've kind of gone up and down over time. We really, in 2018, though, have kind of a new baseline, because we started counting things as a restraint in our logs that we hadn't before. So we probably really need to start with a new baseline. We really had been doing well. I think this is 3 East. This is 1 West, really rarely had them. 2 East, you know, sometimes one of the things I've learned when you really go back and dig into it, it's often 1 or 2 patients. So, yeah, with probably just 1 or 2 patients. So it's, I'm not judging that. The piece that I like though is over here, this little chart, you can see these are just the holds, the physical holds. So these are the things that we wouldn't have counted before. So for 1 West, you know, in the month of December there were 12. 3 East, May, you had 12. So again, we're looking at it differently. 2 East doesn't have very many of those, so you can look, we actually took a nice downward turn on 2 East last year. Here's seclusion. 2017 was a rough year for, and again, I think those of you who have been here and who worked here in 2017, you probably have pictures and people whose names you're not going to say out loud, who you remember that year, but because it often is 1 or 2 people. But I just couldn't be more proud of all of us. You guys worked really hard in 2018 under some really challenging situations, knowing that you had people, you had VPs and directors walking through your unit. You knew that management team was looking at all of the bookmarks of all of your scenarios, and all of the restraint and seclusion, any hands-on event. And we did a fabulous job. You guys deserve just huge kudos for the progress we've made. And I know that all of the work we're doing in terms of trauma-informed care, looking at things differently, we're going to continue on that trend. And we're really, you know, when I think of transformational, I think we're doing some transformational things. And I'm just really proud to be a part of a team that's doing that. So kudos to you guys. We've made some really nice progress. So I'm going to do a little, we're going to do a little partner activity here. And I'm going to try to describe this, I think, a little better than I did the last time. So we're going to take about 2 minutes. You can partner up with someone. It can be someone you know. It doesn't have to be somebody that you don't know. But I want you to, when I did this activity, we literally videotaped this. I'm not going to ask you to do that, but pretend that you're being videotaped, and that, so if it were me and I were partnered up with Jenny, I would answer these questions. I'm going to introduce myself, I'm going to say my name, I'm going to say where I work, and I'm going to say what my role is. And then you're going to switch and do that the opposite way, okay? So it's not really an interview, like I'm not asking you questions, I just want you to answer those questions with your partner, and we're only going to take about 2 or 3 minutes to do it, okay? So.